them.
Hello and welcome, everyone. We'll be starting here in just a minute. All right, and welcome everyone. Thank you so much for joining us for the Developing Family Resource Center Networks. Where do we start? I'm Brenda McChesney. I'm the co-founder and associate director of the National Family Support Network, and I am accompanied today by Andrew Russo, the co-founder and director of the National Family Support Network. Just a few housekeeping issues. If you are joining us today online, you may listen directly through your computer speakers, or if you've joined via telephone number that the Zoom provided, your line has been muted so that we can minimize the background noise. And for those of you online, please note that the link to the Dropbox folder is in the chat. Here you'll see that there are some handouts available to download. In addition, you can put questions in the question section at any time. And the chat section is open for you to include any comments during the webinar, but we do ask that you direct all of your questions to the Q&A section of the Zoom. So questions, go to Q&A. And if you have any tech issues, our live tech support will be here to help you with any questions that you might have. And I'll try to get Andrew and I both will actually try to get to all the questions at the end of the webinar. And if we're unable to, someone from the National Family Support Network will follow up today after the webinar. So today's PowerPoint and handouts and the recording of the webinar will be available on the NFSN website on the Webinar Wednesday page this time tomorrow. So when you exit the webinar, the last thing to note is that an evaluation will automatically appear on your screen. And we ask you to take a moment to complete this as it provides us with valuable feedback to inform our future webinars. All right, so now let's get an idea of who is on the webinar today with us. Speaking of background noise, sorry about that. So here is a map of the United States, and you'll see on it, it's broken up into 4 sections. This is how we divide our national network into regions. So take a second to look at the map to see where you are per this breakout. And I'm going to do a poll so we can see who is with us today. So here you'll see on the poll. Perfect. Where are you joining us today? And we'll just give it another second or two. All right. Excellent. It looks like we have great representation from across the country today with an equal tie, Midwest and the West. I'm not sure I've ever seen that before, coming in strong with a 31 and a 31. So that's fantastic. It's really great to see such representation from across the country. So the second poll we're going to do right now is about your affiliation. So if you could take a second here with this next poll to indicate which type of program and role you represent. So So the options are, maybe you're here from a family resource center or a family resource center network or another family support program. Perhaps you're a parent leader, or you're in early care and education, or you're with the government, child welfare or other, or perhaps you're a private funder. If you're none of the above, please select other, and we will see the results here in just a moment. All right, so representation today, a large majority representing family resource centers. Fantastic to see so many other areas of work represented in supporting families across our country. Thank you so much for your participation. So let's just talk for a second about today's overview of the webinar. So we'll be going through what are family resource centers and what are family resource center networks. Also sharing a little bit about the National Family Support Network, and then going into some of the tools that we have to support you in your work, which include the Family Resource Center Network Developmental Continuum. We'll be highlighting Georgia today in a case study on the work and the development of their family support network. Talking a bit about developing the systems, so with regard to family resource centers and funders. So we'll look at the funder continuum and then highlight some of the NFSN events and resources that you have. What I love most about this webinar, it's a lot of the tools and resources you have to support your work. So we'll be highlighting those and showing you where you can go on our website to access them, as well as the resources that we're dropping in the chat today. Okay, and let's start with oh, I'm going to sneeze. If I sneeze, pardon me. So we'll start with family resource centers, just a little bit of an overview. So thousands of family resource centers have emerged organically across the country, yet their existence is still largely under the radar as what we say is America's best kept secret. A family resource center is a community or school-based welcoming hub of support, of services, and opportunities designed specifically to support families to be strong and successful. The top image on the left is from a community-based family resource center in Vermont. And the bottom one on the right is from a school-based family resource center in Kentucky. So we have another poll here that we're going to launch. About a brief orientation to see how familiar you are with family resource centers. So we love knowing what your familiarity is. So to the best of your knowledge, does your state have programs that look like family resource centers? Give it just another second. Yes, an overwhelming majority of yes. That's what we love to hear. 84%. That is fantastic. So with family resource centers, generally speaking, there is no dedicated federal funding, and yet there are more than 3,000 family resource centers working with more than 2 million people annually. And with the federal funding, it's unlike Head Start or home visitation or after school programs, yet we serve more than 2 million people annually. So why are so many public and private funders at the state, county, and city and community levels choosing to invest in FRCs? Well, simply put, FRCs are just a fantastic idea. They're cost effective. They're highly adaptable for various communities, be that urban, rural, or ethnic. And they have demonstrated successful outcomes through multiple external evaluations. So here you'll see an array of the resources and services that family resource centers provide. They are conveniently located hubs, and Family Resource Center bundle and co-locate many services that may be familiar to you, such as home visitation programs, evidence-based parenting education programs, health screening, play groups, fatherhood programs, family counseling, and food banks, and much more. Despite their organic development and varied funding streams from across the country, there is remarkable similarity in their most common service areas. This data comes from the national study that was done in conjunction with the National Family Support Network, funded by the Robert Wood Johnson Foundation, that shows exactly what the parenting continuum looks like with family resource centers and the access to resources. So parenting supports really exist along a continuum from lighter touch to more intensive services. So here you'll see that a lighter touch example are parenting workshops. And then from there, like looking at parenting support groups and parenting education series using evidence-based programs would get us closer to that more intensive services, with home visitation being a great example of that more intensive touch with families. Then access to resources also exists on a continuum from lighter touch to more intensive services. So as you'll see here, an example of lighter touch is enhanced information and referral, then moving to concrete supports and connecting families with those, and then working with families over time to address family identified goals. So really setting goals and timelines to achieve those goals. And then the more intensive would be actually co-location of resources. So families have a one-stop shop to be able to get everything that they need underneath your umbrella of your family resource center. So those concrete supports directly provide programming such as food, clothing and rental assistance, as I mentioned. And family resource centers not only provide programs, but also build communities of peer support for families to develop social connections that reduce isolation and stress. And we know that isolation and stress are highly correlated with child abuse. So now that I've described family resource centers in more detail, we're going to launch our last poll to ask if you've seen programs that look like family resource centers in your state. That is the poll that we also did previously. So clearly with the 85%, that is there and recognized. So we'll move on to family resource center networks. So family resource center networks consist of 2 or more family resource centers. They also ensure coordinated quality support for families, and they serve as the backbone entity to leverage and coordinate the collective impact of their members. Not only have cities, counties, and states hit upon the value of family resource centers, but they also hit upon the value of networking with them together. So this really is that network of support that ties from the small local level all the way to the statewide level. Data from the national study that the NFSN did with the Research Institute on Colorado came up with these most common core functions of family resource center networks. They increase connectedness, coordination, cooperation, and collaboration amongst their members. They provide training and technical assistance really based on the needs of the unique families that you serve within your community and state. They also provide work on advocacy, policy, and legislation, and provide and maintain a shared data tracking system. So here you'll see the different types of resource center networks, and you may currently be participating in one of these networks, or you may be thinking about initiating them. So we'll start first on the left with the volunteer coordinated network. So this type of network is led by typically family resource center directors themselves in a voluntary leadership position without any paid network staff. So this is how many of the networks, including Colorado, where I initially came from, were created. And other examples of that are New Hampshire and West Virginia. The next one to the right of that are funder coordinated networks. So these might be led by public departments or foundation that both funds and convenes the centers. And examples of funder coordinated networks include New York and Nevada. The next one are nonprofit coordinated networks. And this would be a nonprofit entity that coordinates the network and provides the backbone support with dedicated staffing. The network entity itself is not the network, or sorry, the nonprofit entity itself is not actually the network. The nonprofit may incubate the network and then spin it off in the future, or it may continue to coordinate it. And examples of this within the United States are Alaska, North Carolina, and Washington. And then the last example is the independent network. And this would be a staffed independent nonprofit organization that functions as a membership alliance with members paying dues. These networks may raise and distribute funds like an intermediary or not. It kind of just depends on the need of the network and of its members. Examples of this are Colorado, where Colorado advanced initially from a volunteer network, and also Maryland. So let's look a little bit about the stages of network development. So there's 3 stages when we look at network development for Family Resource Center networks. The first is the emerging stage. I like to think about babies and toddlers here. So it's that first 0 to 3 years when you're just getting started and determining who will be at the table and what you want to focus on. The next stage is the evolving stage, and this lands typically in the 3 to 5 years of network development. And this may be a stage where you're hiring a contractor or hiring your first staff, and the network begins to have more structure and capacity to do so. And the third on the right is our established 5 years or more, a network when you typically have staffing and a track record of activities. One interesting characteristic of these networks is that they have typically they've weathered some crises and have decided to stick together. So there's a real glue that brings them together in this established stage and beyond. And now that we've covered family resource centers and family resource center networks, we're going to look even higher and look at the movement that has formed across the country, which has led to the development of the Family Resource Center, the National Family Support Network. So here you'll see the National Family Support Network. It was co-founded by the 8 state networks that you see in green represented on the map back in 2011. And for the first 4 years of its existence, the NFSN had no paid staff, and the steering committee members coordinated the work of the NFSN as volunteers on top of their jobs of running their statewide networks. And then we get to look at the map today, which I love seeing. So the map today, you'll see that we've grown to over 40 member networks of more than 3,000 family resource centers represented across the country. And over the last decade, this represents a quadrupling in size, and more than 2 million people annually that have been served. And our newest members that are now green on the map are Nebraska, that joined in April, and Wyoming, that joined in September. So just a little bit more about the NFSN. Our mission is to promote positive outcomes for all children, families, and communities by leveraging the collective impact of state family resource center networks and championing quality family support and strengthening practices and policies. So the vision is really about turning the whole map green so that all families will have access to quality family support services in their communities, and provide FRC supports, but to create strong networks. So the areas of work to highlight here, that the NFSN really is about connecting and convening members. We are here to enhance the effectiveness of our members across the country and their individual family resource centers, really through peer learning and mutual support. The second area of work to highlight is that we work by promoting family support best practices and evaluation. We're looking to raise the awareness of what quality family support is and promote a common language, standards, and evaluation of it through the national implementation of the standards of quality for family strengthening and support. And the third area of work is around visibility and awareness. So we're here to raise the visibility and the value and the impact of family resource centers and family resource center networks in order to strengthen and increase support for families. So in doing so, we were working to create a common language and expectations across different kinds of family strengthening and support programs, such as family resource centers, home visitation programs, and child development programs. And we also are here to help ensure that families are supported and strengthened through quality practice. And we have available implementation tools for free on the National Family Support website that we'll show you in just a moment, where you can go and access the standards of quality to review and implement at your local family resource center or within your network. And lastly, just a moment to mention about membership and being able to tap into those deeper areas of work that we mentioned. So we have just a few criterias when it comes to joining the National Family Support Network, that you are a 2 or more family resource centers are coming together in your state. So that's one of the criteria. And the second is that you may be at any stage of network development, as we reviewed the stages on the continuum, and that there's only one network per state that is brought into the NFSN membership. And then the dues, so the dues cover a whole state, regardless of how many family resource centers you have. Whether you have 2 or 2,000, the dues cover all of them. And we really have structured the dues to be affordable and reasonable, particularly with your first year coming on board. So the new member dues are $700 for volunteer coordinated networks and $1,000 for all others. And then ongoing membership dues are $900 for volunteer coordinated networks and $1,200 for all other networks that join. And with that being shared, I will turn it on over to Andrew to talk about the continuums and the additional tools and resources we have.
Thanks, Brenda. So now that we've provided that introduction of FRCs, FRC networks, and the National Family Support Network, we now turn to talking about the development of networks within that context. So this is the first of 2 continua that we'll be looking at today that were developed by the National Family Support Network to illustrate and what it looks like to develop a new network of FRCs. So this one is laid out into 4 different areas, and they are here at the top in the arrows: explore, assess, develop, and operationalize. Those 4 phases in developing a network. And each of these phases is followed by suggested steps that are in the green boxes below. And then the resources that are available through the National Family Support Network to be of use to you in each of those phases as you move through those suggested steps. So this captures in this document in a nutshell what it looks like to plan out the development of a new network. So we'll look at this together in some level of detail. So the very first phase is the explore phase. So in the explore phase, we want to identify who's going to be part of this process, who's going to be part of looking at developing a network in our area, be it a state, be it a county, be it a municipality. So identify who are the key stakeholders to engage with. And that may include existing family resource centers, that may include private funders, that may include public departments, child welfare department, public health. The stakeholders may be different from place to place, but think about who are the key folks to engage when you have this idea of creating a network. And as you bring folks together, then determine who's going to be responsible for the initial coordination of the efforts. So as basic nuts and bolts as who's going to call the meetings, who's going to take the notes, are we meeting in person, are we meeting via Zoom? So who's going to keep the work going in between the meetings. So the designation of roles for the support to move it forward is really important at the beginning. Would also suggest that you review information about family resource centers and family resource center networks, all of which you can find on the NFSN website. It's also in the Dropbox folder that was shared with you in the chat. So lots of information there to get everyone up to speed with what FRCs are on your planning group. There are also the webinars, such as this webinar and many other ones that are on the NFSN website. We'll talk later about where you can find them that could people could watch to get some familiarity with FRCs. As well as we suggest understanding the collective impact framework. So the collective impact framework we talk about all the time because it's about how you bring stakeholders together intentionally and leverage them to have a greater impact together. So that is literally what a network is, with the network serving as the backbone in the collective impact framework language to make all of that happen. So familiarizing yourself with collective impact and that framework will help with the thinking about your network development. And you can also host a presentation by us. The National Family Support Network is happy to come and present for key stakeholders about FRCs and network development. So, for example, if you can identify the key stakeholders in your state, then we're happy to come and present for them via Zoom, for example, if you coordinate a meeting, and that can get the ball rolling for helping people think about the development of a network in your area. And we do that for free. So feel free to reach out to us if you have interest in that. And another opportunity is by participating in the NFSN national briefing. It's listed here as the forum. That's actually the old name for it. It's now called the national briefing. We have that in May every year, and that's a virtual event. So that makes it easier now for everyone to participate in. And that's an opportunity to hear about this work at the national level, all the different pieces, and an opportunity to visit with our member networks. So we actually have the opportunity for people to go out into breakout rooms and meet our member networks of their choosing. So that's a great event in May every year where you can get more of a feel for the work and what different states are doing. And we also encourage folks to think about visiting FRCs and talking with network leaders and network funders, and we can help facilitate that. So all of these resources that I've been referring to as we've been going are also in the blue box there below, such as we're happy to connect you with different states and network leaders, and also provide technical assistance as needed to help you get going. So feel free to reach out to us with that. So for example, let's say you're in a state that has a lot of rural areas and you're wondering, how would we make this work in a state with a lot of rural areas? Well, as you saw from the map Brenda shared, we have an awful lot of states with rural areas to point you to, and could help facilitate, introduce you to some networks, some states that might be in similar situations that would be good for you to learn from, compare notes with. All right, so after you've gone through the explore phase, going on next to the assess phase. And this is when you want to get a sense of the lay of the land. So what's your starting point for thinking about developing a network? And the NFSN has a template that is really useful to be used for this. So it's a template that you can drop into SurveyMonkey and use to send out to different stakeholders, and different states have done that in different ways. We'll talk about how Georgia did it in just a moment as an example. But when you send out this survey, and it can, as people respond to it, organizations respond to it, it can give you a good sense of the lay of the land for what programs exist in your area that look like FRCs or self-identify as FRCs. That's not super scientific because it's self-identification, but that can give you an initial sense of who the players, who the stakeholders might be that you want to be thinking about as you're thinking about developing a network. We do find it's very common that states, even those states that are white on the map that Brenda showed you earlier, that it doesn't mean the states that are white, it doesn't mean they don't have FRCs. It means most commonly that someone just hasn't networked them yet. So for example, in Montana, there are FRCs. In Oregon, there are FRCs. And it's just that nobody has intentionally pulled them together to start a network. So that's what we're always looking at from our perspective, is looking for who will be the catalysts. So I hope that will be some of you on this call, especially if you're from states who are white on that map. We're especially looking to find who are the catalysts and support you to bring stakeholders together. So in the assess phase, you use that survey to identify who might be FRCs and the lay of the land. and then that informs your planning moving forward, because you can circle the wagons with the existing folks and then also determine further development of a network beyond those existing folks too. So the next phase that leads us to is the development phase, and that's when you bring those stakeholders together, convene initial network meetings, and then you'll work together to develop your vision, mission, and goals, identify, again, initial staffing, if you need a budget to cover the costs of different things you want to do, depending on what your areas of work are going to be, planning for all that, developing operating guidelines. This is also the phase where networks most commonly join the NFSN. So once they know, they're committed, they're going to get this going, they join at this phase. Although you can actually join from the very beginning. If a state entity comes to us with the intention of developing a network, we will also welcome them in at earlier stages also. So that joining the network opens the possibility of getting to know all the other members through participating in our activities and events, such as our monthly member meeting and cohorts that we have for networks, such as Emerging Networks Cohort, which is a great way to connect with other states that were just getting started and peer share and learn for them. So we have additional supports we provide specifically for them. And then that we also have our member convening, which is once a year in May also, which is going to be in person in DC next year. Then we move on to the operationalized phase, which is the ongoing work of the network. So you're conducting your regular meetings, determining your initial activities. One of the common ones is having the standards training that Brenda referenced the standards earlier. So you got all these different folks together, getting them all on the same page about what quality work looks like with the standards training has been very helpful. And we'll talk about that in a moment with the Georgia example. And then you'll as you keep going, you'll review and refine your processes and systems as needed. So for all these phases, you'll see technical assistance from the NFSN is listed, as that is something that we're happy to provide, as it's so key to help networks get off to a good start. So these are the phases that are lined out here. And as you heard before, you just need 2 FRCs to have the makings of a network. So if you can get stakeholders together, identify at least 2 FRCs, you're ready to roll with this work. So let's talk about the case study from the Georgia Family Support Network and how they got started a few years ago, as this is a good illustration of putting that continuum that we just looked at into action. So you also have in your in the folder that we shared and will be available and the materials within 24 hours on our website are these highlights from the Georgia story of how they developed their network. And it started with them hearing a presentation like this. So there was a person from the department, the Child Abuse Prevention Department, the equivalent in Georgia, that was at a national meeting and heard the NFSN talking about FRCs. And then that person got it in her head that this was something really valuable that she wanted to move forward. So then she did some research on FRCs in Georgia, and I don't mean research with a capital R. She literally Googled Georgia Family Resource Centers to see if any programs popped up in her state, and she saw there actually already were programs that were using that term. And not all these programs might have Family Resource Center in their name, by the way, but she could tell from the kind of work that they were doing that they looked like Family Resource Centers, as Brenda described earlier. And then a few months later, she reached out to connect with key stakeholders. Key statewide stakeholders here in her state were the Georgia Prevent Child Abuse America chapter and also the Georgia Strengthening Families initiative, to share this idea she had about looking at networking FRCs. So here you see a department sharing with these other key statewide stakeholders. We have this idea, what do you think about it? Is this something you could help us with, etc.? So then, based on that, they're ready to go forward with reaching out to some of those FRCs they had identified, and reach out and called them and said, "Hey, we have this idea, same thing about starting a network, and want to see if this might be something you're interested in." And folks were. And then they developed and sent out that survey. So that survey they sent out to all of their grantees, and they also asked the Prevent Child Abuse America chapter and the Strengthening Family Initiatives to send out to all their contacts as well. And departments sent it out to other departments to send out to their grantees. So that survey went out and out and out and out. And as the responses came back in, then they had their sense of who were the existing players to work with in circling the wagons, developing an initial circling the wagons, developing their network. So then they reached out to the NFSN at this point and mentioned, here's what we've been up to. And they wanted to host the standards training. So that standards training they saw as really helpful to get all those different stakeholders together on the same page about what quality work with families looks like. Because when you stop and think about it, again, all these programs have existed in a vacuum, right? They're all doing their thing, but there's no intentionality around. They weren't funded by the state, in a certain way as FRCs to do certain things. And however they've been funded and keeping their doors open, that's a miracle in and of itself. But it's all been under the radar. So trying to lift that up and connect everyone with intentionality, that's where they found the standards was a helpful step. And they actually required that everyone who wanted to be a member of the network was trained, and their staff were trained on the standards to get that common language going from the beginning. And in March of 2018, they became a member of the national network. So you see in this process that it took less than a year for them to the seed to be planted and for them to get things going. And then they hosted 2 standards trainings. They also budgeted funds that are mentioned here, that initial funds that supported their network development, including the trainings, and they also utilized a consultant to facilitate their initial network meetings. So you see that amount of 30,000 that is listed there. Does that mean you need 30,000 to start a network? No, you just need goodwill of people coming to the table, some dedicated, ongoing folks to keep it moving, and then you build it from there. So that's the Georgia case study there. And then we're going to turn to the funder FRC network development continuum here. So when Brenda asked earlier who is in our virtual room today, we saw that there are people who were working at the systems level, government departments. So for folks working at that level, if you're thinking about funding a network, which this is a little different than where Georgia started. So where Georgia started, actually, you didn't hear me say anything about funding FRCs. They were just circling the wagons, identifying, bring folks together. The funding of FRCs by that department intentionally actually came several years later. So the first step was bringing folks together, developing a network, and later funding came through. This example is different, which is if you're a funder and you're trying to start a network and intentionally fund it. So it starts with a similar prepare phase, which is learning about FRCs with the materials and resources available through the NFSN, visiting FRCs, et cetera. And then move into the planning phase with a planning team. And that may include engaging other funders at the table. We do find the strongest FRC systems in states are ones where multiple funders come together. When FRCs do their work well, it actually achieves the outcomes of many departments: maternal child health, education, child welfare, et cetera. So logically, you might have different players at the table when you start the conversation, thinking about how do we get this going in our state. And you would map out the plan for how many FRCs you're looking for, where are they going to be. We have tools and suggestions that can help with that, about how do you identify, where there's the most need, where you'll get the biggest bang for your buck as you're just getting started, and look at the ways FRCs can be leveraged as now a system that you're building with other initiatives and programs. Figuring out the budget that you're going to use for this, how the programs identify the staff who will be monitoring the programs, the program officers, et cetera, developing the RFP, developing the data management system, and developing an evaluation framework. So all those key pieces that you are getting ready before you send out the request for proposals. And the NFSN has samples of all of these. Good news is we have samples of all of these, so you don't have to reinvent the wheel. You can see how other states have done it, and we have templates and tip sheets with all of those key pieces. So then you've got your RFP all planned, ready to go, and then it's time for procurement, sending out that request for proposals, reviewing them, and awarding the contracts. Then we come to the operationalize phase. So bring all the new grantees together and orienting them on how it's all going to work, such as the data systems you're going to be using, reporting expectations. This would also be a great time to have the standards training. So now you have all your new grantees and get everyone off to a great start with their orientation to familiarity with the standards. And this is where you would also develop your ongoing training plan, provide training technical assistance, and conduct your grantee meetings. And then finally, the monitoring phase. So that's where you're maintaining quality assurance using various tools and procedures, such as the standards themselves actually come with tools that can be used for monitoring. So that makes it really helpful to use those to evaluate how programs are doing, and other tools that may be relevant to the particular work your programs are doing. And that's it. So that's the funder version of this, also available on our website. And then we've come to our buzz session here, which is hearing from you what resonated with you from the information we've shared so far, and what you might be interested to explore more. So we'll pause here now for getting a sense of where you are. Feel free to type that into the chat. What's resonating with you? What sticks out for you? What you'd be interested to explore more. Maybe we shared something that surprised you, intrigued you. Maybe we have some catalysts here. We'd love to hear what you're thinking. If you share that in the chat. If you have a question, if you could put that into the Q&A box, that will be helpful. We will get to those as well. But starting here with what the buzz is of what we've shared so far. Right, so we're looking at that. Let's see what questions we have. So one that's come in so far is from Clarice. She says, I run an FRC, but it is standalone in my school district. I see my state is represented on the map. How do I find out who's running the FRC network in our state? All right, good question there. So what you do is you go to the NFSN website, and if I can ask our colleague Catherine to share this info in the chat. If you go to the member section on the NFSN website, you'll see the map like the one we just shared. But the difference with that map is it is actually interactive. So you click on it and it pops up your state, and pops up a double-sided sheet with all the information at a glance that's key about that state network. So who the contact people are, what they're working on, how many members they have, the network's functions, the center's functions, all that information you can find in that interactive map on the members page of the NFSN website. And thank you to Catherine for sharing that in the chat. All right. Any other questions people have? Feel free to add them in, as we will keep going in the meantime to now lay out some key resources that may be of use to you in more detail. So one, the website itself is chock full of information. So the first part we would flag for you is the FRC page. So the FRC page is your one-stop shopping for all things FRCs. If you were looking to share basic knowledge about FRCs, you can find overviews, background documents about the history of FRCs, research reports, information about systems level funding. There are also videos, parent testimonials, virtual visits to FRCs, school-based FRCs, community-based FRCs. Find lots and lots of rich content all on the FRC page of the website. Another resource are the member network snapshots that I was just talking about, that now you have the link to in the chat. These snapshots pop up when you click on that map. This is a sample of the one from Alabama, the first side of that sheet. It's a two-sided sheet for each of the states with all the current information there. And then we want to tell you about these resource hubs that we have that we're very excited about. The first one is the Family Resource Center Learning Hub, and this is focused on the development of individual FRCs. So let's say you're working to set up an individual FRC in your school district, for example. That's the hub you would use for that, which is full of, again, continuum, and which has a continuum and also information resources that go along with the steps to start an individual FRC. Today, what we're talking about is setting up networks of FRCs. So that has a different hub, the Network Hub, that is also full of this information that we've shared, the different steps, the different tools and tip sheets and samples from different states. Both of these hubs you can access for free, everyone's favorite price. On the website, you just have to type in some information to register for them, and then you're good to go with accessing those resources there. So also to share with you our webinar Wednesdays, like this one you're participating in today. We have several times each month. These are the next two that are coming up. These are also free, everyone's favorite price. On October 18th, so a week from today, we'll be focusing on how FRCs support healthy couples relationships. And that's a really interesting area of work. I know we had a lot of FRCs in today's session, so want to flag this for you, especially that we know that this work is so critically important, and yet actually across the country very few FRCs actually touch it. So very few FRCs are doing intentional work around supporting healthy relationships, healthy couples, and by this we don't mean you're doing full-blown family therapy at your sites necessarily, but what are programs doing to support healthy couples relationships. And we'll hear from some great examples from Georgia and Alabama in particular. And then on November 1st, we'll have a webinar that will share how the Hawaii Network has implemented the standards of quality. And in the Hawaii Network net development story, the standards also were key in that as something they used from the beginning to bring stakeholders together. They are a newer network that launched 4 school-based FRCs virtually at the beginning of the pandemic. You can register for them on our website. There is also a whole library of webinar Wednesdays and that we present in the past that you can access on the website as well. And it's divided up into these different sections that you see here, with webinars specifically about FRCs, FRC networks, like the one we're having today, standards implementation, etc. And so you can find lots of information about FRCs, such as FRCs working with dads, FRCs working with kinship families, FRCs working with teen parents, FRCs working with Native American communities. The list goes on, because FRCs, as Brenda shared before, are so diverse that there are many wonderful things to share about how they do their work. And then you can also see those webinars about different kinds of networks, as we mentioned before. So as Brenda went over those 4 different kinds of networks, you can find webinars from present in the past about each of those kinds of networks and how they've emerged and what their work looks like. So some of the services and supports that NFSN provides, just want to make sure we share with you. One is facilitating connections to member networks. Another is presentations like this and presentations about FRCs, which we're happy to do, as mentioned before, for key stakeholders such as child welfare leaders, Children's Trust Fund staff, public and private funders. Let us know if you can get the gang together. We're happy to come and present. We also provide technical assistance for network development, and we also offer the trainings, the standards training referenced earlier, and also another one on parent advisory committees that I'll talk about in just a moment. So the standard certification training is offered by the NFSN regularly, usually on a monthly basis. The demand has actually been so high, we've been doing it more than once a month recently. And it's also offered by our member networks. So it's offered both by the NFSN, and if you're in a state that has a network, your state network may also be offering this training too. So you can look on our website to find out whether it makes sense for you to access it in your state, or access it through the NFSN network. And these are the next upcoming trainings the national network is offering in November and December. And then this is our training on developing and sustaining effective parent advisory committees. Brenda mentioned earlier that parent leadership is a key core component of FRCs. An example of that are the program's parent advisory committees, where programs partner with parent leaders in shared decision making for their programs. That work and doing it well and doing it intentionally is not easy. So we developed this training that is specifically for staff. So this is not a training for the parents. This is a training for staff about how do we as staff actually step back and support families to step forward. How do we partner in shared leadership and support parents' meaningful engagement in decision making in our work. So this training specifically for staff is also typically offered monthly. It's the only training of its kind in the country, and it is co-facilitated both by staff who've worked with effective parent advisory committees and parent leaders who've served on parent advisory committees as well. So we model that staff parent leader partnership in the training itself. This training fills up very, very fast. So if you're interested in that, feel free to find out more information on the website there. All right, so here's our contact information here, and we're going to turn to any remaining questions that people have here before we close. So I see one here from Kim that I'm just scanning through here. We in our coalition have identified partners in our community that are interested in being FRCs. They both work with very different populations, one being women and children, and the other being largely middle school age children. Should we look at one location, or can both be an FRC? And they're located in Southwest Oklahoma. Okay, so first of all, the great to hear you've identified folks who are interested in FRCs, and also great you happen to be in a state that has a network. So the Oklahoma has a network that is led by the public health department. So one of the first steps we'd suggest in your particular situation is to connect with them. So to connect with the department, with the network folks, and find out, what are they planning? What are they thinking about FRCs and their development in your state, that you're aligned with that. And from the perspective we've shared before, that Brenda shared before, we think FRCs should be everywhere. FRCs should be part of the fabric of our lives, that we wouldn't think twice about a neighborhood having a FRC like it should have a park and a library and a good school. So I could easily see the benefit of there being multiple locations, but I don't know the specifics of your particular community to know what that looks like, if that makes sense, to have two different locations, or whether it makes more sense to combine efforts and have one location. So that would be a really good question to figure out, and would hope that your state network can provide insight on that as well, given your particular landscape. All right, so do we have any more questions here? Anything folks want to share, ask about? All right. Well, we have come to the end of our webinar here. As as Brenda mentioned in the beginning, as you close out of the Zoom, you will see an evaluation pop up that we appreciate your taking some time, a few minutes to not only give us your feedback, but it will also ask you about what you're thinking and what your next steps might be. So then we can be of support to you in your journeys moving forward. So thank you very much for your participation today. The recording and materials will be on the website, but within 24 hours tomorrow. Brenda, anything you'd like to add as we close?
No, just thank you everyone for participating and coming and joining.